Welcome back. We want to tell you about construction that is underway for a brand new pediatric behavioral health center. It's at OU Children's Hospital at OU Health.
It's a big project, and joining us to talk more about it is Dr. Robyn Cowperthwaite. Thanks for being with us, Doctor.
Welcome.
You're welcome.
Yeah,
I'm
thanks
pleased
for joining
to be
us.
here.
Well, and it's a very important topic to talk about. What will
Absolutely.
this new behavioral center bring for children in Oklahoma?
Well, our children in Oklahoma have really been suffering in the last several years with depression, anxiety. Those rates are really going up, and often it's very, very difficult to find emergency care when we need that. So that can be children suffering with suicidal thoughts, self-harm thoughts. So we plan on bringing 72 inpatient and residential beds for emergency psychiatric care for both children, adolescents, and even children with neurodevelopmental disorders and autism.
When you talk about these services, what specific will you be doing to help patients? Because, it seems like parents sometimes don't know how to deal with if their child's struggling with just a mental health, or if it is something more serious.
Correct. Well, we do full diagnostic assessments, the psychiatry, psychology, social work. We provide individual therapy, family therapy, group therapy, parental training. Something that's really unique about our facility that we're planning is that we will allow parents to room in and stay there with their children, which is much more typical with medical care, and we don't see that very frequently with psychiatric care. And we really feel that family dynamic of the parents being involved daily will make a huge difference for our children and adolescents.
Yes. Why specifically is this needed in Oklahoma?
Unfortunately, Oklahoma is a top 10 state for child and adolescent suicide. Wow. And that's really scary, and it is very hard for our children to find outpatient care. Then things get to an emergency point where they need emergency care very quickly.
Suicide, one of the leading causes of death with our young people.
Absolutely.
I mean, we're trying to, it really is, trying to get on the front side of this.
Correct. It is nationwide, usually the second leading cause of death in our children and adolescents. And in Oklahoma, it's even a higher rate than in most states.
Such a sad commentary when you start hearing this.
Correct.
What's the timeline on this? I know we've broken ground so far.
Correct.
Okay.
We've broken ground. The first step of our project is a 10-bed emergency room expansion. So we are hoping that that will be open in February. So that is very quick. That allows us to very quickly get children assessed and find out what the next step is. Now, the full 72-bed behavioral health center, we're looking at 2026. And when that is fully constructed, we will also have intensive outpatient programs and even what we call a partial hospital program, which is like a day program. Like you go to school, like 8 to 4:30, Monday through Friday, that allows us to take care of children while they're still in their homes in evening and weekends.
Is this at the health complex over here, right by where Children's Hospital is as well?
Correct. It is part of the Health Sciences Center. It is connected by Skywalk to Children's Hospital, allowing all of those medical professionals to take part in any medical needs that those children may have. It's right across from our Veterans Hospital.
Yes.
Yeah.
I'm so happy that we're talking about mental health and behavioral health. It's something that we need to continue covering, and we're so glad about this new project at OU.
Absolutely.
Thank you, Dr. Cowperthwaite.
Sure.
We appreciate it.